Welcome back to another NCLEX review. If you're preparing for the NCLEX, you know how important it is to master high-risk medications like anticoagulants. These drugs can save lives but also cause life-threatening complications if not used correctly. Today, we'll cover the different types of anticoagulants, priority nursing interventions, and real NCLEX-style questions to test your knowledge. If you're looking for a structured way to boost your NCLEX prep, the Nurse Navigator Network is here to help. We provide high-quality, focused reviews to make sure you walk into your exam with confidence. Now, let's jump into today's lesson. Anticoagulants, also known as blood thinners, are medications that prevent blood clots from forming or getting larger. They do not break down existing clots, that's the job of thrombolytics.
Vitamin K antagonists VKAs, prevents the liver from making clotting factors, example, warfarin Coumadin. Direct thrombin inhibitors, blocks thrombin, preventing fibrin formation, example, dabigatran Pradaxa.
Factor Xa inhibitors, blocks factor Xa to reduce clotting, examples, rivaroxaban Xarelto, apixaban Eliquis.
Unfractionated heparin UFH, a fast-acting 4 or sub-Q anticoagulant, example, heparin. Low molecular weight heparin LMWH, a more predictable form of heparin with fewer risks, example, enoxaparin Lovenox.
Anticoagulants are commonly used to prevent and treat blood clots. Here are the most common indications.
Deep vein thrombosis DVT, prevents clot formation in the legs. Pulmonary embolism PE, prevents life-threatening lung clots. Atrial fibrillation AFib, prevents stroke in patients with irregular heartbeats. Mechanical heart valves, prevents clot formation on prosthetic valves. Post-surgical patients, prevents post-op blood clots.
Anticoagulants are life-saving but come with serious risks. Let's go over the key side effects and nursing interventions you must know.
1. Bleeding. NCLEX priority, monitor for bruising, hematuria, melena black stools, and nosebleeds. Hold the dose and notify the provider if signs of bleeding occur.
2. Antidotes for reversal, warfarin, vitamin K phytonadione, heparin/LMWH, protamine sulfate, factor Xa inhibitors and dabigatran, and dexamethasone alpha and idarucizumab. 3. Frequent lab monitoring, warfarin, monitor PT/INR goal, 2 to 3 for most patients, 2.5 to 3.5 for heart valves, heparin, monitor IP goal, 1.52x baseline. 4. Dietary considerations for warfarin, avoid excessive vitamin K-rich foods, leafy greens, broccoli, liver, consistent intake is key. 5. Heparin-induced thrombocytopenia HIT, life-threatening low platelets caused by heparin, monitor platelet count and stop heparin if HIT develops. 6. Importance of wearing a medical ID bracelet. Patients taking anticoagulants should always wear a medical ID bracelet or necklace. In case of an accident, emergency responders need to know that the patient is on blood thinners to prevent life-threatening bleeding complications. 7. Stopping anticoagulants before surgery. Anticoagulants should typically be stopped 5 to 7 days before surgery to prevent excessive bleeding. Always consult the healthcare provider before stopping anticoagulants. Kidney function considerations. Many anticoagulants, especially factor Xa inhibitors rivaroxaban, apixaban, and dabigatran, are excreted through the kidneys. Patients with kidney disease may need dose adjustments or alternative medications. Monitor renal function tests SPUN, creatinine, GFR regularly. Use the mnemonic clotting to remember anticoagulant safety. C. Check PT/INR warfarin and heparin before giving. L. Look for signs of bleeding gums, urine, stool, bruising. O. Only give vitamin K if warfarin INR is too high. T. Teach patients to avoid NSAIDs, aspirin, and alcohol. T. Tell patients to keep a consistent diet. Warfarin. I. Increase precautions for fall risk patients. N. No IM injections, risk of hematoma. G. Garlic, ginger, ginseng, ginkgo equals bleeding risk. Monitor for signs of bleeding, bruising, black stools, hematuria. Check PT/INR warfarin and heparin before giving. Know the antidotes. Warfarin equals vitamin K, heparin equals protamine sulfate. Teach patients to avoid NSAIDs, aspirin, and alcohol. Consistent vitamin K intake is key for warfarin. No IM injections, risk of hematoma. Patients should wear a medical ID bracelet. Stop anticoagulants 5 to 7 days before surgery per provider orders. Monitor kidney function, especially for factor SA inhibitors and dabigatran. If this video helped you, like, subscribe, and turn on notifications for more NCLEX reviews. Got a topic request? Drop a comment below.